Today's episode, we're going to do a little bit of a review on how that brings about toxicity. And then we're going to start to follow what toxicity does through the body. So we're going to start in the adrenal, part of the HPA axis, and we'll sequentially go through some different systems so you can understand what's going on with toxicity. This is really a critical thing because most people think that infections and other things create the bulk of their symptoms inside their body, and the reality is most commonly a lot of these are created by toxicity and not directly from whatever's going on, like people with Lyme disease. It's not directly from the Lyme, it's indirectly through Candida and leaky gut, and then the Lyme toxins add on top of that, make that worse. You add anything else, it makes it worse. So it's really critical to understand how all of this works. These are some of the keys on why people don't heal. So stay tuned and we'll get into this. So this is your Health Reclaimed, where we expose the roots of Lyme and all chronic illness so you can finally heal, help you to understand the root causes of Lyme and chronic illness so you can reclaim your health and restore your life. I'm Dr. Brad Montagne, veteran functional medicine doctor. We're the one clinic where a lot of the people come to us, they've been to multiple other doctors, never got any help, and we get them healthy again. So it's a one-stop shop for one, and we're a huge resource for all kinds of information that's critical and vital for him. So let's get into this one. When we go back and we look at the whole issue of Candida leaky gut, we've got two things going on. We've got a destruction of the mucosal lining of the gut, and that lining is only one cell layer thick. And at the same time, we have a loss of the healthful flora that lines the gut, that does the bulk of our digestion, that also creates some of all of our neurotransmitters. Those are the chemical switches that turn on nerves, and some of all of the hormones too. So when the healthful bacteria, microbes is a better word, wash out the colon and down into the gut as a whole into the toilet, then pathogens grow. Candida is one of the biggest pathogens. We established earlier that all medicines will do this. Your NSAIDs, antibiotics, steroids, antifungals, your neuroleptics, the psychotic ones for depression, they all wreck the gut and the gut flora. Chronic stress, food intolerances, heavy metal toxicity. There's a multitude of factors that go on, but this progression happens within all of them. If you hold your fingers up in front of your face, your fingers represent the lining of the gut called microvilli. Each finger is a different microvilli. The microvilli increase the surface area of the gut about 400 times. The microvilli that secrete a mucus that fills the space in between the microvilli, caps over the top. That's where all the microbes live and grow and do the bulk of their work. So with a leaky gut going on, there's some inflammatory issue that's going on inside of the gut. Lumen is the hole where everything goes through. And as that happens, if you lock your fingers together, try and pull them apart, that's what the tight junctions are like in between all these cells that line the gut lining, all the mucosal cells. And the mucosa is only one cell layer thick. Inflammation starts to loose that finger-locked, Velcro-like junction in between all the cells. Toxins start to leak in between the cells. The base of the cells, they start to respond to the toxins, call the immune system to come in and try and plug all the holes. They can't do it. The mucosal cells secrete some other chemicals that try and expose the antigens. The antigens are just the identification of toxins, microbes, and everything else that escapes through the mucosal lining that's starting to leak. And then the T helper cells come in. They spread those out like flower petals opening up to the rest of the immune system so they can recognize and deal with it. The T killer cells come in, try and deal with that. The T killer cells They can engulf things, and engulf things, they have something called a lysozyme, where primarily lysine, and those will go dissolve the cell membranes of living organisms and kill them. Well, the lysine doesn't do anything for the toxins. If anything, it'll toxify the immune cells and make them so they don't work very well. Then the beta cells come in. The beta cells are the ones that make antibodies. They make antibodies against it, and the beta cells start to attack the antibodies. Problem is, the antibodies start to attack the toxins, and wherever the toxins are. One of the problems is those toxins are in the mucosal cells, and the antibodies start to attack the mucosal cells, destroy the mucosa even worse, makes great big holes in it where toxins, microbes, undigested food particles can just get right into the bloodstream. That overwhelms the liver, and so all this stuff ends up spilling outside the liver. As all that's going on, the healthful microbes are washed down into the toilet. Pathogens are growing. Candida is one of the biggest pathogens that grows in there. Candida creates its own toxins. Acetaldehyde is 7 times more toxic than embalming fluid is formaldehyde. It creates a lot of destruction. It starts to kill your dopamine nerve cells, and that makes so you can't feel good, and you got all these things going on together. And when we back up, detoxification has 2 phases. Phase 1, there's 5 different pathways that creates free radicals, makes things much more toxic than they were in the first place. Phase 2, there's 6 different pathways. Those make those free radical toxins water soluble, no longer toxic, and allow them to be excreted out. Pathological detox is if you have an upregulated phase 1 and phase 2 is not working very well. So it increases the free radicals in your body, and there's no way to neutralize those and excrete those. So that's a major, major problem. The 4 detox organs, and this is critical to get in your head and remember this, are the small intestinal lining, that's mucosal cells we're talking about, that are being destroyed by the inflammatory responses. The colon mucosa being destroyed by all these inflammatory responses, and all that gets concentrated in the colon, and it's worse in the colon. The gut flora, which all the healthful stuff is being destroyed and washed down the toilet, no place for it to hide. So then the pathogens grow, and the pathogens don't have the detox pathways in them, and the liver's the other one. So the liver gets overwhelmed with all these toxins. They spill outside into the rest of the body and start to create havoc in every cell, every organ system, and all the hormone systems throughout the body. So we'll start to look at that response in the adrenal glands. The adrenal glands are supposed to control inflammation. So whenever these toxins start to escape, the adrenal glands have to upregulate the production of cortisol and adrenaline. Adrenaline is typically stronger than cortisol. Those are your anti-inflammatory hormones. And the adrenaline, you got epinephrine, norepinephrine, some other hormones in there which are many times stronger than cortisol. As those hormones get released, it's supposed to calm down the inflammation, but it also starts the fight or flight response. And with an uptick of cortisol and or your adrenaline hormones, one thing that does very quickly is it starts to dissolve, and the technical word is lyse, to break down your muscle tissue. And it does that to liberate amino acids. Those amino acids get converted into sugar very quickly inside of the liver. And that sugar's given so you can defend life-threatening situations. So this is where the primary control of your blood sugar comes from, is through the adrenal hormones, cortisol and adrenaline. It's not through insulin and what people think. It's not through the diet. It's primarily through adrenal response to inflammatory reactions. Chronic stress will do the same thing. There's different chemicals will do that. Caffeine certainly markedly increases the uptick of cortisol and adrenaline quite a bit. So whenever the toxicity rises, the adrenals dump out the cortisol and adrenaline. That tries to calm down all of the inflammatory fires. Meanwhile, the cortisol and adrenaline is attacking your muscles to dissolve the muscles to liberate the protein that gets converted into sugars in your liver, and that markedly raises your blood sugar. So I had a dialogue recently with somebody I worked with a long time ago. They've got a bunch of health issues going on and blood sugar dysregulation, a lot of them. This is where it comes from, and it's really, really vitally important to understand this. So as the other side of the cortisol response and adrenaline response goes on, it calls, in a general sense, the immune cells to come to the rescue wherever the inflammation is going on. And so the immune cells, they start to rally inside of the body, and they're drawn to the place where other chemical signals are going on, where there's some inflammatory response going on to try and calm that down. The longer, and that works short term, the longer the cortisol adrenaline response goes, it actually reverses what it does to inflammation, and it creates it rather than tries to calm it down. So if somebody is chronically stressed, way overstimulated, too toxic, the adrenal hormones of cortisol and adrenaline are doing the opposite of what they're designed to do, and they're still raising the blood sugar, but they're increasing the inflammation, which calls for more adrenaline and more cortisol. Meanwhile, the adrenal glands are like a little hat on top of your kidney. They're very strong, very powerful, very critically important hormonal gland. The adrenals also control your kidney function. They control your postural blood pressure. So if you get lightheaded when you go to rise up from sitting or lying, that's adrenal insufficiencies. They used to call that orthostatic hypotension. Now they call it POTS, and that's always driven by the adrenal glands. They also make the precursors, the sexual hormones, pregnenolone and DHA, and those get converted in peripheral tissues and gonads in both men and women into the sexual hormones. So women, even when they're cycling, about 50% of the conversion into the sexual hormones of estrogen, progesterone, and testosterone, yes, they make testosterone too, happens in peripheral tissues, and only half of it in the gonads. Before she cycles, it's mostly peripheral tissues, and after she quits cycling, perimenopause and menopause, it's 100% in the peripheral tissues then. So that's always going on. They don't talk about that so much with men because they don't have the same problem as women do overtly, but men and women have the same issues. So if we back up with embryology, there's no difference in a male fetus and a female fetus up to about 7 weeks after conception. If it's a male, about 7 weeks, there's a small shot of testosterone. The ovaries grab the round ligament that holds a woman's reproductive system in place, descend down through the inguinal canal into the labia. The ovaries become the testicles, the labia becomes a scrotum, and the round ligament becomes the spermatic cords. So, and I could go on, but there's no point in this discussion for the rest of that differentiation, but the genitals move over into the male position instead of the female position, and you get a closure of the vaginal opening. And that's why you see a seam on the bottom of the scrotum, is because that was the opening beforehand, and it fuses together and makes a seam. So when we look at the progression of making of those sexual hormones, pregnenolone and DHEA get converted first into progesterone, in both men and women. Progesterone converts into testosterone in both men and women, and testosterone converts into estrogen in both men and women. Those conversions are different rates in men and women, but just the same, we have the same progression going on. Well, as the inflammatory responses keep going on, and there's more and more demand for cortisol and adrenaline, the pregnant DHEA gets shunted off of the pathway to make sexual hormones and move over to make the corticosteroid hormones, the cortisol and adrenaline. So there's nothing left to feed the sexual tissues and to feed the hormonal needs of sexual function. So when this happens, you start to see atrophy of the sexual tissues. Women will notice their breasts are no longer as full or nor holding the shape that they used to. There's atrophy of the external genitals in both men and women that goes on. There's a reduction in the ability for the tissues to erect in both men and women. And erectile dysfunction is as big of an issue, if not bigger, in women than men. So this toxic response creating problems, and we're just talking about a direct response from the inflammatory issues from the toxins. If we add on top of that the direct response to the adrenals are one of the two most sensitive hormonal organs to toxicity itself. So this leads to a pretty major dysregulation of sexual hormones, of inflammatory response, of immune response. It upregulates the blood sugar tremendously and puts people in pre-diabetic state, no matter what they eat. It's the toxicity, inflammatory response, and all the hormone changes that are creating all this. So if we go back and we review all this, the adrenal response to the inflammatory reaction of the toxicity escaping from the gut, it raises the blood sugar and puts people in a pre-diabetic or driving to a diabetic state. It calls all of the immune cells to come rally to wherever the inflammatory response is. So it stimulates the immune system to come to the aid. It wasting the muscles away at the same time. It's shifting all of the precursors to build sexual hormones over to build the hormones that deal with inflammatory response. There's nothing left to build the sexual tissues, and with that, the sexual tissues start to atrophy. There's change in function, there's change in volume, there's change in responses, there's change in all of this. And this is a huge, huge, huge factor that not enough people are talking about this, because this is one of the things that really starts to divide couples. Intimacy falls off the cliff as far as this goes. There's a whole bunch of reasons why. All kinds of... It requires a very sensitive understanding. Without the sexual nurturing of sexual tissues, a woman, she doesn't create the same lubricants that she normally does. So the reproductive tract becomes dry and painful. You just have this whole ball of wax going on, and it's not because she is trying to make things up. Physiologically, it's very difficult for her, and it really drives a wedge between couples. So it's hard to survive the chronic illness, dysfunction in all aspects, especially when you throw the sexuality dysfunction in there, because that's one of the few anchors that hold relationships together. You take that away, and there's really not that ability to keep things alive and fresh. So this year, Health Reclaimed, I'm Dr. Brad, veteran functional medicine doc. Share this with your friends. People aren't talking about these things. It's really critical to get this information out. put some reviews on our site, share this around, have your friends put some reviews on so people can realize how important these things are and what we're saying. We share these every Monday and Thursday. We'll see you on the next one. Thanks. Have a great day. Bye.